start the recording. So hi, I'm Katie. Um, Amy and I work for the Kansas City Healthy Lifestyles Collaborative, which sits inside Children's Mercy. And I help to support some, pardon me, of our societal sector groups of the Kansas City Physical Activity Plan, which one of our sector groups, and you'll learn a bit more about that today, is our public health sector, which we're just launching. Joey, do you want to go next?
Yeah, thank you for being here, everybody. Joey Leitner, I'm an assistant professor and program director of the public health program at the University of Missouri, Kansas City. And happy to be here and work through this stuff with you guys. You know, the stuff that Robin, Katie, Shelley, and the team have done over the last couple of years has been really great. And so I think, you know, public health has a role in physical activity promotion and you know, making it happen in the city. And so happy to support them and happy to be here with you guys to hopefully, you know, figure out what we can do to move public health forward. Mary Ann, you want to go next?
Sure. Hello, my name is Mariana Hengler. I am the Strategic Initiatives Manager here at the Jackson County Health Department, which serves Eastern Jackson County. As far as physical activity and healthy lifestyles, we have a community health improvement plan. Our most previous one ended at the end of 2021, which healthy eating, active living was one of our priority issues. We're in the early stages of doing our next community health assessment, which will then prioritize or will find issues to prioritize. We imagine that physical activity in some way will stay a part of our priorities. So happy to be here. I've been a little bit of some of the other physical activity plans just kind of on the periphery. So excited that there is a public health specific sector now. Thank you.
Alex, you want to go next?
Yeah, so I'm Alex Francisco. I'm the Chief Science Officer at the Kansas City Health Department. I direct the Office of Population Health Science, so we also do the community health assessment. We weigh in on some of the changes to the CHIP. We set a lot of the data related priorities for the department. One of the things most recently that we did was utilize the behavioral risk factor surveillance study data, which drill down to the census tract level. One of the variables within that data set was it's actually those who did not exercise at least once in the last month. It's always hard to keep that one straightforward. But what we found at the census tract level, utilizing those data, was that it was within the top 5 leading disparity related reasons for lower life expectancy. So we're in the draft plan sort of on what we can do about that. I can drop the link to it in the chat, but we've overlaid sidewalk health on that, and it actually overlays really clearly. And so, you know, as far as what we currently do for physical activity promotion, it's fairly limited, but we're looking to move towards that space.
Sandra?
Hi, I'm Sandy Reese. I'm a dietitian with the Johnson County WIC program, and we also we're part of the Johnson County Health Department. Actually work in the health department, so public health is a big thing around here, and part of community health. That's the division that WIC is separated into. So get to kind of work with other community health representatives and things throughout my job. We've had less of the interaction since COVID started, but we're getting back to that and trying to work together to help each other and get our community connected. But physical activity is definitely something that's on everybody's radar, I think, because you know, it's important for overall health, like we know. even at a little age. So WIC, we work with pregnant women and moms, new moms, and kids from birth to age 5. So kind of focusing on activity for little kids in my work.
Great. Thank you, Sandy. Chelsea?
Hi, everyone. Can you hear me okay? All right. Yeah, so I'm Chelsea Reinberg, and I am with Johnson County Research and Extension with K-State, based here in Olathe. And my role is nutrition, food safety, and health, kind of all things related in those worlds. I am a dietitian and do a lot of promotion of physical activity. Physical activity is a passion of mine, working with kids. So although I'm not necessarily in a position of more of like public health in terms of really digging into the data, it's more about the community outreach piece and bringing the partners together. And one of the activities that I have scheduled in the city of Shawnee with a wellness hub that they have going there is kind of a nutrition, physical activity summer camp for the kids. So just happy to be here and kind of collaborating and connecting everybody together.
That's awesome. Thanks, Chelsea. Dan, I see your camera on. Do you want to say hi? Bonnie, same thing. I see your camera on too, but I don't know if you want to unmute and say hi.
Hi, this is Bonnie. I'm a registered nurse at the Mercer County Health Department up here by the Iowa border. I'm just checking in to see what we can do. We just got our community assessment will be completed this week. And some of the focus groups have been talking a lot about their concerns with physical activity. So I'm just looking to see what we can do to make that happen in our little community up here. Thank you.
Cool, right on. Stevie, you want to say hi?
Yeah, sure. Hi. Sorry, I turned on my camera and realized that my light was causing some disruption. My name is Stephanie Watley Hopkins. I'm also with K-State Research and Extension. I'm in Wyandotte County. So it's called FNEP. It's an acronym. It stands for Expanded Food and Nutrition Education Program. Next year, we're also going to have SNAP education, but that's a work in progress. So I right now work with families who are extremely low income, who have children underneath the age of 18, or children 3rd grade up to 26 in post-adolescence. So I work with a lot of different individuals. We do a lot with kids, or focusing on making sure that we can raise our kids in a healthy environment, both food and physical activity wise. One of my big programs that I teach is called Families Eating Smart and Moving More. So it's in the title. We want to eat smart and we want to move more, and making it so those are activities that we do with our littles as much as we do with ourselves. I have a master's of public health and I'm certified in public health. So this sector really felt like the most appropriate for me. And yeah, it's just good to meet you guys.
Cool. Well, thanks for being here.
Yeah.
Natalie, I see you're unmuted. Would you like to say hi?
Yeah. Hi, everyone. I work with Katie and Shelly at the Kansas City Healthy Lifestyles Collaborative. I'm not overseeing this sector, but I still like to attend the meetings and hear about what everyone's doing. So yeah, nice to meet you guys.
Good to see you, Natalie. Shelly, do you have service to say hi real quick?
I think so. Hi, everyone. I'm Shelly Summer. I manage the Healthy Lifestyles Collaborative at Children's Mercy, Kansas City. And you've already heard Katie and Natalie introduce themselves. We're all part of the same team. We all support different sectors for the physical activity plan and are happy to be here and see this sector get started.
Simone, good to see you on the call.
I was on mute. I got it. Good morning. I'm Simone Taylor. I am the Regional Women's Health Analyst in the HHS Office of the Assistant Secretary for Health. So here in Region 7, so our work is focused on Missouri, Iowa, Kansas, and Nebraska. And I work on kind of all things women and girls health and looking at improving outcomes and partnering to do that with folks in our region and in our communities. And so one of our priorities is around physical health. And so we are just trying to kind of engage in that space in the region. So thank you for having me here.
Good to see you, Simone.
Good to see you, sir.
Chelsea Blakemore.
Hi, everyone. Sorry, my camera's not on. I'm in the middle of pumping. Sorry, I'm trying to do it all. My name is Chelsea Blakemore. I am with Platte County Health Department, and I'm a community health development specialist with them. So I always tell people I wear a bunch of different hats. So I help groups and programs from early childhood to older adults. And I am currently the chair for the Northland Health Alliance Healthy Food Access Group, which Alex is also on. So we're just trying to improve physical activity and nutrition kind of everywhere. So I'm excited to be a part of this group, and I really appreciate the invite.
Well, it's good to have you here, Chelsea. Teresa. So I think we have Teresa and Dan. If you guys want to say hi, go ahead, Teresa.
Hi, this is Teresa Tunstall. Sorry, I have a wonky voice. I have a paralyzed vocal cord. I'm not sick or anything. So I'm sorry if you can't understand me, but I'm a nurse and a health educator here at Clay County Public Health Center. I've worked here 18 years. I'm partially retired. I just work part-time, and I work on our maternal child health contract, which our focus areas are physical activity and healthy nutrition. And our big event of the year that we do, it's an annual. Last year was our 7th year. This will be our 8th, is Family Fun Day, where we really showcase those kind of community partners. We had over 35 vendors last year, and we held it at Mackin Park in North Kansas City. So those of you that are familiar, that's one of our big parks in the Northland. And we had probably between at least 700 to 800 folks that attended. So we're looking forward to doing it again this year. I also am the educator for doing smoking, vaping, any kind of nicotine cessation. I target our WIC prenatals and postpartums, but I target anybody who comes into the health center and sees the sign and wants some assistance. And so I work collaboratively with WIC also, and I do the marketing for all of our clinical areas.
Sounds like a lot of work, Teresa. Holy cow.
I love it.
That's awesome.
They can't get rid of me.
I love it. That's great. Dan, last but not least. And I think you're still muted. Sorry.
Sorry, I just had to step away. I'm jumping back into it. Let's see. Yeah, let me give you an update on kind of what I'm doing. I don't know if I'm trying to remember if I was at the last meeting. I think I was, and shared that I recently shut down my bike shop here. I had my e-bike shop, and I've kind of I'm kind of transitioning back into healthcare management and consulting, and doing some projects on network development for some of the health plans. And so that's kind of been my recent forte back into my old stomping ground, so to speak. So I don't have really any update on any projects within the project we're working on here. I do need to get back in touch with some of the billing and program piece for kind of moving the ball forward with the revenue cycle things that we had discussed in the healthcare group. So that's kind of it.
Cool, right on. Well, it's good to have you here. And yeah, there's a lot of overlap between healthcare and everything else that's going on. So Katie, I want to turn over to you because I know you are the king of running the show here. So what's next?
Okay, so I'm going to provide a brief overview of the Kansas City Physical Activity Plan. And when I say brief, I mean brief. I'm going to keep it to like 4 or 5 minutes because I really want us to have time to work on these strategies. But give me just a moment so I can pull up this PowerPoint. Can everyone see my screen? Nope, I lied. There we go. Okay. All right, everyone can see, right?
Yeah, that's good, Katie.
Okay, thanks. I wasn't sure if you guys could hear me.
Yeah.
Okay. So again, I'm just going to give a 5-minute overview of the Kansas City Physical Activity Plan and why we're all here today, so that you kind of have a context about what is happening outside of the public health sector. And we think that this is important because one of the unique aspects of the Kansas City Physical Activity Plan is that it's multi-sectoral, meaning that you guys will do great things and they're going to connect to each other's sector through this broad umbrella of the Kansas City Physical Activity Plan. Okay, so the Kansas City Physical Activity Plan started in 2020 and it was just before the pandemic, and it's based on the National Physical Activity Plan, which has been around for about 10 years. And so we basically modeled ourselves after the national plan. The Kansas City Physical Activity Plan is a comprehensive multi-sectoral collaboration working to foster a culture of active living in our region. The plan itself is organized into 10 societal sectors, where each of these sectors has developed strategies, which are general goals for a sector. And then within each strategy, there are anywhere between 2 and 5 tactics, which are more specific objectives. So things that can be done to achieve the strategies. Ultimately, we don't want this plan just to be something that sits on the shelf. So implementation of these strategies and tactics is a big part of what we are doing, which I'll talk about more here shortly. So here at the Kansas City Physical Activity Plan, sectors, these are all of our sectors, and it includes their leads and implementation groups. We won't go into each of these just for the sake of time, but so our sectors that we have in the Kansas City Physical Activity Plan include schools, healthcare, sport, mass media, parks and recreation, infrastructure, faith-based, business and industry, early childhood, and public health. So essentially, these are all organized how people spend and live their lives. And hopefully you can look at this list and kind of say that on any given day, you touch 2 or 3 of these sectors, and over the course of a week, you probably touch around 7 or 8 of them. And you can start to see where if each of these sectors start to just do a couple implementation projects related to these strategies within each of those sectors, then all of a sudden we're building up a collective pool of activities that we think will have measurable impacts on physical activity in our region. So we do have 3 publications that are available on our website right now. We have the Kansas City the Kansas City Regional Report Card on Physical Activity for Children and Youth, the Kansas City Physical Activity Playbook, which is just a summary document of the Kansas City Physical Activity Plan, and then we have the Kansas City Physical Activity Plan itself. And Natalie will go ahead and drop the link to the website in the chat if you're interested in learning more about each document, but I won't go into too much detail. And if you would like to hear more about each publication, you can also watch our first meeting recording on our YouTube channel, and Natalie will also drop the link for that as well in the chat. So on the right side of your screen, it's the Kansas City Physical Activity Plan, and it was released in 2021, and it includes information on all of the strategies and tactics for the Kansas City Physical Activity Plan. It is loading. I apologize. Huh. Okay, there we go. And so here all of this. Oh no. I lost signal. Let me try that again. I need to pull it up. Well, all I was going to do is just share what our strategies look like, and go from there. So.
Is there anything I can help with, Katie?
Oh, no,
Sorry.
it's okay. That was just a bummer. I like completely closed PowerPoint down, so I need to pull it back up. Oh, thank you, Joey, for dropping in the national plan. I appreciate that. Okay, let's try this again. We were on this one. Okay, so these are the strategies for the Kansas City Physical Activity Plan. And overall, we have 34 strategies, and there are actually around 80 different tactics that support these strategies, which are specific to their sector groups. So there's a lot of information in the plan and within each sector that really kind of guides us how we can create opportunities to be physically active. And I also wanted to share this slide because each sector has a different approach to our strategy development. And so this is an example of what the mass media sector did. And they used this virtual whiteboard, as you can see, and they started out by ranking some strategies, and they did some prioritization based on impact and ease of implementation. And then they did some more specific thinking through barriers, implementation, and then just some other things that need to be considered. So this group, our current public health group, the current plan is to kind of follow a similar format to the mass media. So what we're doing today is we're going to start by ranking the strategies of the public health sector based off the national plan's public health sector strategies. And we're going to look at which ones are most essential and if they're applicable to the Kansas City region. And then this is just more of an up close version of our strategies and tactics. And you can see the tactics labeled underneath. So in the end, this is what we'll be creating that will help guide this group for future like implementation projects. But that was it. Okay, so I hope that that provided enough information, was brief enough. Did anybody have any questions before we go ahead and start voting? Okay, perfect. So, oh, Joey, were you gonna say something?
Yeah, so guys, I do want to just say that like whatever we do, so today we're picking strategies, we'll pick tactics later, but whatever we're gonna do is gonna be implemented. So we already, the Katie and the team already have funding to help implement this stuff. So when we're thinking about voting on like, you know, what we're gonna do, there's money behind this. And so we can really like make it happen. So I just wanted to put that on the table that like, when we're moving forward today, you know, whatever strategies we pick, we have the resources to move forward. So that's all.
No, thanks, Leitner. Yes, so pretty much today we're doing the strategies. Our next meeting will be tactics, and then our 5th meeting will finalize it. And once we get this group up and running, then we can apply for funding. There's $10,000 for each sector to initially to start off with to come up with an implementation project. And then there's additional funding afterward if it's needed. So just a heads up. We're a little behind all the other sectors, obviously. We're just getting started. But if you would like to go ahead and grab your phone, I'm going to share my screen again. And if you just want to scan this QR code, this will take you to Mentimeter. And I need to pull that up. And then we'll go ahead and start with the voting. So I'll give everyone just a moment, okay?
And if you don't have your phone, you can do it on the computer, but it really is easier.
Yeah, go to menti.com and use this code. It's 46 90, 63, 68.
Everybody ready to go? I have it pulled up on my phone. Yep. Okay. Katie, do you want us to start voting?
Yeah, I was just gonna pull it up or on screen too. Yeah, go ahead and start and I lied. Can you guys see the screen?
Yeah, we can see
Okay.
it. Sharing. Yeah.
Oh my goodness. Okay,
Yeah.
perfect. So thank you. So yeah, so we're gonna start with the strategy prioritization. So this survey is going to, yes, thank you for reading it. So I know you've read it. But pretty much what strategies are they represent a set of choices used to achieve an overall objective. Strategies are useful in defining long-term objectives and in planning for how to meet those goals. So that is what we're doing today. I did tactics so you understand that the next meeting, we're going to focus on tactics, which represent the specific actions used when applying a strategic choice. Okay. I think we're good to go now. So I already gave you definitions. This is strategy 1. Now it's strategy 1 has 15 tactics. So just a heads up, but this is the first strategy of the National Physical Activity Plan for the public health sector. And its public health organization should develop and maintain a workforce with competence and expertise in physical activity and health, and that has ethnic, cultural, and gender diversity. And you should probably see on your voting screen this tactic as well. So if you forget it when I move on to that screen, but just briefly, again, there's 15 tactics and we're not going to go into those, but I wanted you to be able to see them. Okay. So based off of that first strategy, how likely is this to be implemented locally? And then the next one is, do you think that this can be implemented locally in the next 3 years? And then do you think that this can be implemented locally in the next 5 to 10 years? And how likely is this to improve physical activity and health?
Katie, on mine, it says the voting is closed.
What?
It says voting is closed down below too. Yeah, on yours. Press, what is it, C to open voting?
Okay, now, is it
there you go.
working?
Yep.
Perfect. Thanks for that.
Okay. Sweet.
Okay.
And don't let the voting already influence your voting, right? Like if you don't think it's gonna work, then that's valuable. That input is really valuable.
Yep. So I know I'm not voting, so that's 11. I don't know if Shelly, are you able to vote? I know you're on your phone. Okay, I'm gonna go ahead and proceed though to the next strategy. So strategy 2, public health agencies should create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote physical activity. So again, strategy number 2 is public health agencies should create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote physical activity. And There seems to be 5 tactics to that one. So whenever you're ready, go ahead and vote. Okay.
I like how it also gives you the the blips in the distribution. So like a lot of people on the first one, I think, are answering like 3 or 5, but not like 4, which is cool. Right.
Yeah. I think we're waiting on one more person. There we go. Okay. So the third strategy is nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity and public health practice, policy, and research. I believe there's 8 tactics to this one. Let me double check. No, there's 11. Okay, so again, strategy 3, nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity and public health practice, policy, and research. Oh my goodness, there's 16. I was way off. Okay. So if you want to go ahead and start voting. Okay. So strategy 4 is public health agencies should expand monitoring of policy and environmental determinants of physical activity and the levels of physical activity in communities surveillance, and should monitor implementation of public health approaches to promoting active lifestyles, so evaluation. So again, strategy 4 is public health agencies should expand monitoring of policy and environmental determinants of physical activity and the levels of physical activity in communities, and should monitor implementation of public health approaches to promoting active lifestyles. Okay, and there's 10 tactics. So whenever you're ready. Oh, hey.
This kind of covers more of the outcomes based stuff. It looks like kind of tracking and outcomes.
Yeah.
HEDIS and metrics and stuff.
Okay, we've got one more person. Was everyone able to vote? I think we're still waiting on one more. Oh, there we go. Okay. So I believe this is the last strategy. So strategy number 5, public health organizations should disseminate tools and and resources important to promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives. So again, strategy 5, public health organizations should disseminate tools and resources important to promoting physical activity, including resources that address the burden of disease due to inactivity, the implementation of evidence-based interventions, and funding opportunities for physical activity initiatives. And there are 5 tactics to strategy 5. So whenever you're ready, you can go ahead and vote. Okay. There's one more, there's more strategies. So strategy 6, public health agencies should invest equitably in physical activity, commensurate and with its impact on disease prevention and health promotion. So again, strategy number 6, public health agencies should invest equitably in physical activity, commensurate with its impact on disease prevention and health promotion. And there are 5 tactics to strategy 6. Whenever you're ready, if you want to go ahead and vote. I think we're waiting on one more person. Okay. And once we're done with voting, that was all of the strategies.
It might be me. My phone went dead.
Oh no, that's okay.
And it was charged at 62 a minute ago. I don't know what happened there. I got my other phone. Let me grab my other phone. Maybe I can go into that link. Let's see.
Dan, if you also would like, I can send you the link. You should be able to vote even after.
Okay.
this meeting.
Yeah, well, I have them. It's at menti.com, right?
Yeah,
And then, yeah, it just shoot me that link and I can do it through email
yeah,
or however you want to do it. Yeah.
yeah,
That's
I can do
great.
that.
I'm gonna go plug this in.
Okay. So that was just the first step. Thank you everybody, by the way, for voting. And I'll share the results of these, what everyone thought was most important in a newsletter. I send them out monthly, so you get notes of the meeting, a recording of the meeting, and just some general updates from the group. But I will share the results of the Mentimeter. And then what we'll do with that is when we're finalizing our strategies, we'll bring those back up and discuss them more in depth in our May, I believe it's our May meeting. So, but that was really it. I know we were going to also discuss like, so you got to meet everyone today, hear a little bit about everyone's background, and with the leftover time that we have, just kind of discussing who's missing from this group and who can we invite to just, yeah.
Katie, if I can I jump in? Sorry, is that
Yes,
okay?
please. No,
Okay,
please.
okay. Thanks. So, guys, I'm really interested. So those are the 6 strategies that are in the National Physical Activity Plan. What did you think about those? And like, are those realistic? Are they good for Kansas City? Like, what's your like reaction to those 6 strategies? Like, I think the funding one is really cool. I don't think it's gonna be hard, right? But like, if we could get like communities to invest equitably in physical activity, that would be huge, right? What do you guys think about
I think they're definitely in line with where the direction that we need to go, and it's a lot of moving parts. Like I always say, it's business has to be on board, the health plans, the community, and our representatives, and that's kind of the trifecta, I think. But the specific to the questions we had today, I mean, I think the parameters that you use, a 10-year, I thinking of that, because sometimes it is, it might not be 10 years, but it might be 7 until these programs and initiatives are up and running and delivering what we dream they will. So I thought it was the alignment, and then I was sneaking trying to read the tactics. I was reading the tactics earlier. I'm going to go back because it's out there. I checked in on the plan before I got on, but I think my feeling is it's could be a reality, and I think they're well aligned and thought through.
What do other folks think?
I think just thinking about it from Jackson County, the strategy, I think it was 4, related more towards that surveillance piece. Just thinking about our own capacities, that's something that we can do more of than that programmatic piece. So I could see like us having a role in that, and probably deferring to organizations, nonprofits, those types of things, doing more of that like actual programmatic side of things, just thinking about our own capacities. But really something that as a whole we're trying to push towards. So definitely having a role in that surveillance.
This is Teresa. All the years I've been in public health, the different type programs that we've offered, my biggest concern always has been the families that are at risk, that live in Section 8 housing, that there's no safe way for those kiddos to really participate in physical activity much. And I've done some grants where I helped subsidize different kids. There was like a drawing to help with the community center membership. But I think that if we can get our community partners like the WISE and community centers to be aware of the kiddos that don't have the financial means or a parent that can transport them, I think that is at least I think of our county, the kids most at risk from not, being able to participate in hardly anything. And I know that schools have cut down the amount of PE time once they get to school age. And I'm in my 70s, so I just think that's terrible. I think back when we used to do the President's Fitness Test. And so from an older person, I don't see it getting better. I see it getting worse, especially for our at-risk families. And that's my biggest concern. How can we help those at-risk kiddos to be able to participate in some way?
And that really lends itself to the partnership strategy, right? And public health is good at that. And, I've done some studies looking at like partnership and public health, and that's a key role. What do other folks think?
I thought that the nonprofit one was an interesting one, just coming from the nonprofit world. I think it's a great idea and it's very valuable and important, but I think the practicality of it, and nonprofits are already stretched so thin, and sometimes they don't have somebody designated to policy work and the skill set. So I think, building skill set takes a long time, and then funding streams and stuff to the nonprofit. So while I think it's important and very needed, I think the reality, especially smaller nonprofits that probably have a lot to contribute to policy, especially at the local level, just don't have the capacity.
It's funny, Chelsea, you're saying that right as I was like getting ready to type in the chat that basically that same thing. I was concerned with a lot of those nonprofits. Do they have the capacity to add to their responsibilities? And we're seeing a large turnover among the people that work in all of public health right now, but especially those smaller nonprofits where they can't compete with the workforce. And I just wanted to reiterate what Chelsea was saying, because it's exactly what I was thinking about. I agree that it would be nice if we had the capacity, but I just don't know if that's the reality.
So you guys, this is so interesting. So, because from my perspective, like if I think of like Bike Walk KC has done some really great policy work in Kansas City, Missouri. And so most of my expertise is in Kansas City, Missouri, right? And it sounds really different in like Wyandotte and Johnson County. So that's super interesting. Okay. So I mean, that's an area of improvement, right? That we can do something about. Go ahead, Chelsea.
Yeah, I think it depends on the organizations, right? And their interest as well. I think a lot of people that go into nonprofit don't have that mentality of the influencing of the policy. And so I think some of those organizations have that one person who knows that that's like the key and is the driver behind it. But, I've only been in this area for about 1.5 years, so I can't necessarily speak to all of the organizations, but just from my other nonprofit world. And that's kind of more DC, where policy is also prevalent there. But I think, yeah, it's a mixed bag with the organizations, and some have the capacity and the desire, and then other people are like, I'm just gonna stick to my programming and in my lane.
I think on that note too, so I think we're lucky that Health Forward is going to push nonprofits to think about policy. I think that's their new kind of their switch of things. And I think, and yeah, I think Bike Walk KC is like the perfect example of doing the programs, doing the policies, getting in front of all the people, but they're different than a lot of other organizations do, just knowing that reality. I think from like the public health agency side too, in policy, that is something that we are trying to address as well. And we have limitations on what we can do as far as, is it lobbying, is it this, is it that, but we are really trying to move the needle on policy here in Eastern Jackson County again. So we have a team that's just looking at the impacts of the state legislator policies and tracking all of those bills. And so I think there is some, again, kind of going back to that collaboration that you spoke of, and that partnership piece that I think, while maybe not doing that direct piece, public health can kind of serve as that background resource, kind of doing those policy briefs, doing that larger surveillance, kind of having that stepped back role.
Yeah, I would second that. It's really like a matter of logistics, I think. Like, I rated pretty much all the ones that where public health agencies would do something as extremely, like, very infeasible over the next 3 years, just because we're trying to, rebuild. And I've seen some data that demonstrate, it was and again, this is Kansas City specific, but this was in the business plan, that people are going to start diminishing their view of public health again because we're not needed anymore. Everybody thought we were super important during COVID, and I sort of foresee a sort of pendulum swing back to like, oh, well, we don't need public health anymore. So, we've been thinking about how to leverage partnerships. Partnerships are going to be the best way to get to the legislators too, which would then help the public health agencies end up taking some of the responsibility. So that's just to second everything that has been said on that front. I think that's probably the best, most realistic way to implement some of this. through a public health agency is actually going to need to be those nonprofits first, advocating for the policy changes with our support, and then it'll come back to us. At least that's how I see it in my head.
No one has mentioned the workforce, the strategy one, the workforce stuff. What do you guys think about that one?
I think we were talking about public policy. You know, a lot of the money and policies are going to flow and do flow. Even from the federal government, the state legislatures, as we mentioned. I think of all the nonprofits, particularly in in Medicaid. We're talking about social determinants of health and some of those that fall through the cracks with these policies. Just for regular medical care, we're kind of overlaying another preventative benefit that does, that I think once it gets traction will provide, outcomes, real improvement. That's why we're all here, because we believe in that. But a lot of those policies, as we're expanding them with these initiatives and others, I think once they gain traction, will filter down to even some of those smaller nonprofits, to make a difference. And I'm thinking more along specifically. There's waiver programs that get federal and state match grants that really have a big impact. They focus a lot on keeping, Medicaid, specifically Medicaid and Medicare dual eligibles, out of giving them patient-centered care, because I think it's the three-legged stool. You've got, the patient has to buy in for these programs. The funding has to be there in the programs, and then the providers have to be available in a fiscal umbrella to be able to deliver them. But I think a lot of the infrastructure to do that is in place. It's just it's all these moving parts, getting them aligned within these kind of initiatives to make it work.
Yeah, I think we got to be careful with healthcare, like getting in the bag here, because I think everybody is here for public health, and there's a distinct line between healthcare and public health, which is what we like to teach. But getting back to kind of the workforce question, Shelley put something in the chat. I don't know if anybody has any reactions to that, but I do want to just have a time note, because we only have 5 minutes. And so Katie, I don't know if you want to take over and tell us kind of the next steps, and if there's any other work that we need to get done today.
No, not today. So next steps is that our next meeting in March, we're going to vote on the tactics. And as you saw for some of those strategies, there's a lot. I think tactic 1 had 15, or sorry, pardon me, strategy 1 had 15 tactics. And so we'll look at those and then vote what is best for Kansas City. And mind you, this is something I didn't mention, is that we can tailor these to be more specific for our area and how they can better suit Kansas City. But we're just starting with a base at this point.
So Katie, are we gonna have all of the strategies, or are we gonna rank, or are we gonna have pick 3 of them or something like that? What's
the group will be able to decide that. So out of those 5 strategies, we don't have to keep all of those. So if you think that one is not applicable again to Kansas City, then we can nix it, and we can focus on the strategies that we see fit.
That's a great question, Shelley.
Yeah. So Shelley said in the chat, my other question for the group is anything missing from the strategy list? So that's something to think about.
I want to say I read something in maybe the plan that someone dropped in the chat about infrastructure being a later date. Is that because that was the only thing that I thought of, but then I remembered I did see something that referenced it somewhere, if I'm not going crazy.
Are you talking about the infrastructure sector group?
Is that, yeah, maybe. Like I said, I was reading through the plan, and I just know that, there's a space for public health to advocate for the infrastructure. And so that's where I was leaning towards, is just, that's the only thing I couldn't think about fitting into the current strategies as something about physical infrastructure being necessity for this kind of thing.
Yeah, no, I agree. And we do have an infrastructure group who kind of focuses more on that side. They're kind of on a hiatus until later on. We're kind of reestablishing that group. But the great thing about the Kansas City Physical Activity Plan is that we focus on collaboration and cross-sectoral work. So we have the opportunity to reach out and connect with that group to kind of bring them into what the public health sector wants to do.
The comprehensive plan, the Casey playbook, I think is what it's called. In the public health section, and that's all physical infrastructure related in that public health section that my team and I pretty much wrote. We did include things conducive to this. So I don't know. I just wanted to mention that because it's actually open for public feedback right now, or should still be at least. And so there'd be that just an opportunity to try to coordinate some stuff there.
Yeah. And if you want to drop that link in the chat, if you're looking for some of, yeah. Or if you want to email it to me, I can share it with the group as well.
Yeah, and I think if anybody has any other areas that maybe aren't mentioned that public health can do something about, or that like this group has the expertise to do something about, then I think bring those up. And let's talk about them at the next meeting. So next meeting, we're gonna solidify which strategies we're working on, right, Katie? And then vote on tactics for those strategies. Is that right? Okay.
That's correct. And I dropped the link to register for the next meeting in the chat.
I'm gonna pipe in here for just a second to give a little bit of additional information. So one, on the infrastructure sector, that sector has already identified their strategies and tactics. They just haven't been meeting on a regular basis due to a change in leadership for that sector. But you're absolutely right in needing to connect these two groups. And then I also want to make sure that the group understands that you have plenty of time to identify and, I guess solidify, for lack of a better term, the strategies that you think make the most sense. And as you're going through the tactics for the different strategies, you may change your mind in some ways. At the next meeting, I would encourage the group to, let me say that differently. All of the tactics do not need to be confirmed for all of the strategies at the next meeting. We can do that over 2 or 3 meetings or however long it takes. So we don't feel like this process is rushed.
That's a great point, Shelley. Thank you so much for that. So we have plenty of time, guys, but let's do it right so that we can, hopefully implement and get something moving forward. But it is 1 o'clock and I know we're all busy people. So thank you all for being here and we'll see you next month. All right. Thanks, Katie. Thanks, everyone.